welcome to Chief Executive Shout Out. This is the July edition, which makes it the second of 2022. We've got lots of really exciting things to cover today. But just at the back of me, you can see over my shoulder is the emergency department, and I've got a few things to say at the end of today's shout out just about the exciting developments that are going on there. And we've got a few more things happening, as you know. So at the time of filming, we know that COVID is back on the increase, and we are now reinstigating masks right across the hospital. And we know that the pressures outside of the emergency department continue. But what never changes is the fantastic work that you're all doing each and every day. And today we'll just hear a little bit about some of that work from our matrons, but really importantly, some of the exciting plans we've got for Derriford Hospital that are not that far away. So part of what we wanted to cover in the July Chief Exec Shout Out was about our transformation journey that Derriford's on. So we're not just dealing with things today, we're thinking longer term and in the future. And I'm really, really delighted that today I've been joined by Mac Armstrong, who's a radiologist in the hospital, but importantly, he's also the clinical Chief Information Officer, and he's working with our teams to set out that vision and, more importantly, practically setting out what we need to do, when and how much it's all going to cost and what the benefits are. So Mac, really delighted to welcome you to the July Chief Exec Shout Out. Tell me a little bit about the digital journey. So go right back to some basics. Why does it matter? What's important about it?
Thank you, and thank you for giving me the opportunity. It's quite apparent that unfortunately Derriford is in the lowest 10% of trusts in the UK in terms of digitisation, so we're really not doing particularly well in terms of giving a good digital offering to our patients and our staff. We're still centred on the patient paper record, and the paper record is really quite old-fashioned now, and it can only be in one place at one time. And what we want is a system which allows us to have information flowing in a modern way through the hospital. What that gives us is an environment which is really quite negative for our patients and negative for our staff. It's not an easy place to work, it's not an easy place for patients to interact with, and we've got clinicians out there who are logging on to 7 more pages with 7 different logins at one time. It makes it very difficult and very inefficient to work. So what we're trying to do is to modernise that and get ourselves into the modern world. We started by putting in Nerve Centre and EPMA. These are things which are going in now, which are going to make things much better for the patients and the staff in those areas. And there's been an enormous amount of work to put those in, but it's not going to take us the whole way to where we need to go. We need to go the next step to an electronic patient record.
We've certainly seen in places like the emergency department, where we've got high volumes of quite complex patients coming through, their system was absolutely not fit for purpose. So we've just put in Nerve Centre. So tell me a little bit about how that's gone, who was involved, and what are the early benefits that we've seen and some of the challenges.
Thanks. So this is really all about patient safety. So the previous IT system in ED was a really good system. People were very familiar with it, but it was end of life and it wasn't really able to incorporate the modern developments in terms of the pharmacy and the observations on patients that we really need for safety. So the new system is more capable of doing that, and also capable of drawing in more information from other parts of the hospital.
So just tell me a little bit about the planning, because it was a huge amount of work from everyone involved, and how well did it go? If you would like to score it out of 10, I've always got a bit of anxiety about new IT systems.
I have to say, I mean, I'm probably slightly biased, but I have to say I think the go live has been 8, 9 out of 10 in terms of how well it could have gone, and that is really down to the hard work and dedication of the team that did it, both in terms of the project management under Hannah Wilson-Rudd, but also the really firm leadership of the SRO, Nanette Bothma, who is one of the ED clinicians. And so that starts at the very beginning with really careful process mapping of the way that things worked at the beginning, and then design of the new system, design of the implementation, and then most importantly, the engagement with the clinical teams and the education of the clinical teams, so that when it actually came to go live, people were prepared for that change. Because there's obviously a huge amount of anxiety on the day of go live, and everyone needs to be supported at the point of go live and afterwards.
So just tell me a little bit about where we are on our EPR journey, and what do you think will be most transformational about that?
Patients can't quite believe that they have to tell their stories again and again, and that and clinicians find it very difficult to believe that they have to enter the same information again and again in different systems. So the ethos behind an EPR is to have one database which is centrally secured and managed for our area, within which everybody can access. You tell your story once and it's used multiple times. That's the sort of ethos behind it. The most efficient way and the safest way to do that is to collaborate. So at the moment in Derriford we have over 150 different IT systems, and trying to get them to collaborate is virtually impossible in spite of our really dedicated IT team. And Nerve Centre is just one of those 150. So the way to move forward is to amalgamate a lot of that functionality into one core IT system for the hospital. In fact, what we're trying to do is to partner with the other acutes in the region, which is good in terms of economy of scale for the contract, for the buying, also for the training of staff, but also for the functionality. So we're very close to getting an EPR. We don't know exactly which one it's going to be. We've shortlisted down to two. They're both world-leading products. We will be working with a partner organisation, a partner acute trust, which gives us an economy of scale in terms of delivery. And we should have that product in place within the next 2 to 3 years. I think that's my best guess in terms. Now the other thing is that it's very important that we're going to be partnering with our primary care colleagues as well, because obviously we are part of the Plymouth community, and our patients, the majority of our patients come from our local GPs and other primary care organisations. So they have really good and really mature IT systems. Unfortunately, those IT systems are not suitable for a hospital of this complexity, so we're going to be putting in an EPR suitable for an acute hospital, but that will make our amalgamation work more straightforward between our IT system and the primary care systems. So we do have a mind to that as well.
So Mac, thank you very much for your time today. Really, really exciting developments, and I think if we put digital alongside our new builds and along with what we've been talking about for the emergency department, of course, we will start digging the ground towards the end of this year to build a new major trauma ED department and interventional radiology theatres. So put that with digital. Really, really exciting developments. Thank you. I'm really delighted to welcome two of our colleagues who've been setting up and establishing a really, really important campaign, which is called Meet the Matron campaign. So I'd like to welcome Victor and Nikki. So Victor, you're the head of nursing for surgery, and Nikki, you're one of our fabulous matrons. Now, apart from the fact you seem to be everywhere all of the time, running around the hospital, getting things done, I'm really pleased you've had a bit of time to think about a Meet the Matron campaign. So Victor, I think this was your idea. Tell me a little bit about where the idea came from.
Well, it all started with COVID, to be honest. So we knew communications were difficult from both ways, the clinical teams to families, and from families and patients to the clinical teams during COVID, because of the restrictions that we had on visiting, etc., etc. And at the same time, the other reason what made me think about this, was the fact that the matron role, we always have that really old school picture of the matron, but we probably, as a public, we struggle sometimes to understand what they actually do, and matrons actually are in charge of looking after the quality of the services where they work on, and they are that catalyst for making things happen the right way, if that makes any sense. So for me, this campaign allows patients, relatives, friends, and families to reach the matrons in a very structured and successful and quick manner, and as well actually gives that quick access to the matrons and give them the awareness of what things they can actually discuss with the matrons at what time. They have different ways to access that. So there's an online way to actually message the matrons now or email the matrons. But also we will be putting posters up in the wards for them to be aware of who the matron is, and it will include a picture of the matron and how to contact them when they're in the building as well, if they have anything to share, good things, bad things, things for improvement, anything that they want to discuss with the matron. We want to make that role that is accessible to understand how good their services are and what they need to make them even better.
Well, it's a brilliant idea, Victor, and thank you for describing how it works. So, Nikki, you are one of our matrons. So tell me a little bit from your point of view. Has it started? How does it work? And what do you think the benefits are going to be?
Yeah, it's a real privilege. I speak on behalf of all my matron colleagues. We really want to be visible and accessible in all our clinical areas. So that's our wards, our theatres, departments, and any area that we cover. Our patients see us on the ward. They're not entirely sure how to address us with their relatives. Do they write a letter when they've left? Do they catch us on the ward? So this is a perfect opportunity to have a really timely response. We endeavour to get hold of the person almost immediately, and it can be a couple of things. Like I got contacted by a chap who really felt that one of the nurses on a night shift on a ward that was caring for his mother had really gone above and beyond what he expected, and I was inclined to agree with him, and feeding that back at that point to that nurse who was probably just got up from her sleep after her night shift was really powerful. Some of the minor issues I've had to sort of storage of personal food, where I was able to find sort of a safe place for somebody who'd been in for quite some time. That came from being contacted through Meet the Matron as well. So it has been really successful, and we just hope it sort of takes off more and people use this opportunity whilst the relative is still in hospital. We like to see people face to face.
Presumably it also helps if people are not quite satisfied with the way that we're caring for their loved ones. They can raise that with you early on, and that hopefully stops it, sort of festering and becoming a complaint.
Yeah.
And have you had any examples of that?
Yep. So the patient who had been in for a lengthy period of time was in a bed space that probably is the least desirable one in the bay, and it was almost fixing that. So they've got a window seat, not a patient on either side of them. After nearly 4 weeks in hospital, I felt made lots of other minor issues resolved as well. Sometimes it might not be a nursing issue, it might not be something that the matron can fix from their perspective, but we are the common denominator to be able to find somebody who can become involved. So I've discussed with hotel services, and I've had a discussion with one of the consultants as well, so all of us together have fixed an issue. But yeah, it comes through the matron because we're kind of the glue to all of the service to be able to help fix this.
And it is all about people, isn't it? I mean, that just sounds fabulous, and I love the fact that you go down as quickly as you can to deal with it in person. So this is a new campaign for us. How are we evaluating it, and what will be the next steps, Victor?
So at the minute, and thanks to the comms team because of facilitating that, we are making sure that we are contacting back any user of this new method of contacting the matrons. So any patients or any relatives or friends who have used this tool will get a phone call to follow up how the response was. So far, I think what they all commend is the simplification of a process to actually raise or share information, because sometimes it's not actually raising a concern, it's about sharing information that sometimes is positive for the world to know or is meaningful for the world to know about the patient, and they all feedback that it's a very seamless process, and the quick response from the matrons as well, which sometimes is, as Nikki said, within hours, which is great, and they're all very surprised but grateful about that.
That's brilliant, and I'm so excited to hear about this campaign, and I know the Trust Board will want to hear about it, because it's fairly new still, isn't it? And that will just be brilliant to get that feedback. So Victor and Nikki, can I just thank you all both very much indeed.
Thank you.
So as you can see from the July shout out, what a lot of fantastic work is ongoing, and increasingly we'll be able to set out the plans for the future of Derriford. But just on a last few points, if I could, during July and August we've got some great announcements that we'll be making about supporting you as our colleagues right across the Trust, and making sure that your outstanding contribution continues to be recognised each month with a series of acknowledgements for the great work that you're doing. I'm really looking forward to having a bit of a break at the end of July, but then coming back in August, September and October to very much be out and about. And as you know, it's what I love doing the most, is spending time with you and your teams. So if you'd like me to come and spend a bit of time with you over those 3 months, just let me know and I'll make sure that we get that in the diary. And you can tell me firsthand what it's like working here, what your hopes are for the future, and what else we can do to help and support you during these really difficult times. And finally, I couldn't finish July's Chief Exec shout out without a proper acknowledgement to our outgoing chairman, Richard Crompton. Richard has been the Trust chairman for 10 years and has made an outstanding contribution, not just to the hospital, but right across the health and care system, where he's worked and led a number of initiatives that continue to put Plymouth in a really good place. He's always been an absolute passionate advocate of Derriford Hospital and our local health and care services, and he's really made a terrific contribution around supporting people who are disadvantaged or have additional needs. And I know that one of the things he loved most was the annual graduation of Project Search, which it was my pleasure to attend a couple of weeks ago. I have to say personally, Richard's been a great colleague. He's been a really challenging colleague, but in a way that really helps you be a better chief executive, and I know I shall miss him very much. But soon we'll be able to announce the new chair, and we'll very much look forward to handing over the baton and taking Derriford and our health and care services forward for the next 10 years. So have a great month, take care of each other, and look forward to the August Chief Exec shout out.